Hello, hello, hello. We're back. Yay, another lesson here. This one's a big one. Well, it's an important one. Not long, but important. And we're going to talk about cardiovascular health and how menopause increases that risk. Of course, the disclaimer, remember, this is not medical advice. This is educational, informational purpose. It has educational, informational purpose and does not serve as medical advice. Please go talk to your own provider or find one. If you're looking for a menopause specialist, you can go to the Menopause Society website, and they have links or a list of certified menopause providers. Um, or you can search locally, talk to your primary care doctor. There's a lot of ways to find someone who can help once you have all this information, though. So now remember, I'm not affiliated with any drug or drug company. No one's paying me to promote their drug or their lab or their imaging test or anything like that. Okay, so we want to talk about estrogen's role in having its cardioprotection, basically. How is estrogen protecting not just the heart, so that's what cardioprotection, but blood vessels in general? So we do know that estrogen promotes vasodilation and reduces the risk of atherosclerosis, which is where plaque builds up inside of blood vessels. Now, estrogen helps promote that vasodilation by um, activating more production of nitric oxide. Nitric oxide helps to relax the blood vessels or dilate the blood vessels. So when you have less estrogen production, then you have less nitric oxide production, and then you can end up with more constricted blood vessels. Okay. Also, estrogen, it acts as a strong anti-inflammatory hormone. So estrogen, it decreases inflammatory signaling in blood vessels, and it reduces all the pro-inflammatory chemicals in our bloodstream, like something called TNF alpha, IL-6. It does all sorts of things like that. So, and it limits how much even white blood cells, which are part of inflammation, can stick to the lining of blood vessels. So it's all very, very interesting. It's actually a lot more information is what we're learning about how estrogen affects the blood vessels and can prevent heart disease. Um, whether this will be something a provider would recommend for you will depend on a lot of factors. So it's not going to be for everyone for prevention of heart disease, but it is something that is being promoted for a lot of women, but it's not necessarily for everyone. Okay. Now, estrogen also reduces a chemical called endothelin 1, which is a vasoconstrictor. So, vasoconstriction means the blood vessels are tightening, okay, getting less flexible and more tight. And what would that lead to? That would lead to higher blood pressure. Okay. I also want to make sure you understand that estrogen, um, women who are naturally having estrogen before menopause and after estrogen have lower LDL cholesterols, which is their bad cholesterol, and higher HDL cholesterol. So, this is one of the factors that is also very important for prevention of heart disease, because the more bad cholesterol you have, the more likely you are to develop plaque in your arteries, which could later lead to strokes and heart attacks. Okay. Okay, so as I was saying, menopause does lead to a loss, if you're not continuing to have estrogen in your system, a loss of the estrogen's protection of your blood vessels. So you end up building up that plaque or developing atherosclerosis. The number one killer of women is heart disease. Okay, that is what women particularly, and men and women, die of in later ages. So if we can do something to help prevent that, I think that that's actually a great goal and a great find. All right. Now, high blood pressure, as I stated, will go up. So, be more likely to develop high blood pressure in menopause or when estrogen levels are dropping. So, even in perimenopause, because estrogen promotes, again, the nitric oxide production. Nitric oxide causes dilation of blood vessels naturally. The other thing that happens is that estrogen protects that endothelial lining. So the lining of blood vessels is called the endothelium or endothelial cells, and they just don't function as well without estrogen. Estrogen helps them to function better. It helps to lower the inflammatory chemicals. So we want to have the blood vessels or vascular flexibility rather than stiffness. We want blood vessels to be more dilated, more stretchy, and that way blood pressure isn't going to be higher. And then, as I stated, estrogen also helps you to keep your HDL cholesterol higher and your LDL cholesterol lower. So LDL bad, HDL good. HDL you can also increase by exercising more. LDL you can bring that down by avoiding all those animal fats. Triglycerides also avoid animal fat, avoid processed food with things from a box, things from a can, things that are in a bag, chips, things like that, all can contribute to higher LDL and triglycerides. So it doesn't have to necessarily be animal fat, but animal fat contributes. Okay. The other thing is, so metabolic syndrome, which we did talk about quite a bit, there's a higher risk of metabolic syndrome because when you gain that weight, as your estrogen levels are dropping, your body becomes more resistant to insulin and you gain that weight in the midsection. And as we talked about, that will then contribute to more dysfunction of use of insulin in your system. And also, it also goes hand in hand with the elevated cholesterol. So then when you have elevated cholesterol plus insulin resistance and maybe pre-diabetes and diabetes, all those things contribute to more cardiovascular disease, buildup of plaque in blood vessels and potentially leading to heart attacks and strokes. And who wants any of that anyway, right? Heart attack, stroke, I don't want any of that. So what can we do? What can we do to prevent all of these things from occurring? So obviously there's the dietary changes to lower your cholesterol, to lower insulin resistance, and to improve blood pressure. So avoiding too much salt, avoiding too much alcohol, and avoiding processed food, eating whole grains, avoiding animal fat. And then, of course, exercising. We talked about the cardio exercise. That's really good for your heart. It's been shown in numerous studies. So getting at least 30 minutes of cardio 3 times a week reduces the risk of cardiovascular disease. But we're talking about preventing that insulin resistance, which could lead to metabolic syndrome, which can lead to cardiovascular disease. So you still want to do that resistance training, lifting weights, keeping your muscles strong because muscles lower the chances of insulin resistance. And we lose muscle as we age, so we have to work harder to keep our muscles. Of course, quit smoking. And I don't know why I don't have it on the slide. Don't drink. I mean, if you want to have one drink a day, one glass of wine, one beer, I'm not going to totally fault you, but I'd prefer if you cut back to once or twice a week having one drink. So we'll talk about it in our next video, but alcohol is also associated with cancer risk. Excuse me. And screening, right? You go into the doctor. It's important to check your blood pressure. You can go to any pharmacy and check your blood pressure in their machines. And some people will have blood pressure machines at home themselves. And getting your lipid panel checked, which we did talk about before. If your lipid panel is abnormal, initially trying to work on weight loss and exercise and diet to improve it. But if there's a long way to go, it probably is just better until you get to the weight you want to be, until you're getting to the exercise level you want to be. Go on a medication if there's not any contraindication. Go on medication to lower your cholesterol. And then later you could always see if you can go off of it. But, in the meantime, while you're trying to do things with diet and exercise and weight loss, that cholesterol is still high and is contributing to plaque buildup. Okay. And then blood pressure. If your blood pressure is elevated, go on a blood pressure medicine. And then if you lose weight and you start exercising a lot and your blood pressure is really rocking and your doctor is okay with you trying to go lower on your blood pressure medicine or go off, great. But don't try to fight being on some of these medications, because the medications are preventive. And then back to the screening, just making sure your blood glucose is normal, whether it's a fasting blood glucose. I prefer doing a hemoglobin A1C, which checks how your blood glucose is over a course of 3 months. Okay, so in summary, we talked about estrogen and how important it is in the role of preventing cardiovascular disease. There's a lot of chemicals in our bloodstream, natural chemicals, of course, things that are produced by the cells. That estrogen improves those profiles, improves the flexibility of the blood vessels, and prevents them from being too stiff. And that can help prevent atherosclerosis and hypertension and dyslipidemia and metabolic syndrome. And the first step is always getting screened, and then, of course, trying to do some lifestyle changes. And then if that doesn't help, taking medications. Okay? See you next time.